Hello, my name is Rish Ledesma, and this is the Gait Development Through the Lifespan presentation. So, this presentation outlines how human gait changes through early childhood and continuing into older adulthood. In this presentation, I will highlight some of the common gait characteristics, developmental theories of gait abnormalities, and review some of the physical barriers at each stage by comparing toddlers, children, adults, and older adults. We can see how musculoskeleton and nervous systems maturing leads to more efficient walking patterns, and then how entering old age changes these patterns. So, the purpose of this presentation, reviewing the concepts that gait is continually developing across the lifespan as a reflection of the overall maturity of several systems, many developmental delays, structural changes, or even injuries can cause gait disturbances. Many age-related changes affect gait, and overall efficiency is known to peak in young adulthood, and then can decline rapidly with aging. So, definition of gait. A brief definition and overview of the gait cycle. So, the term gait is defined as the way humans walk. It specifically involves the coordination between the musculoskeletal system, the nervous system, range of motion in the joints, and the ability to process important sensory input. The development of and declination of this coordination throughout the lifespan is responsible for the way that gait patterns change significantly. When looking at gait differences across age groups, it's important to break the act of walking down into specific components of the gait cycle, which include the base of support, the stride length, arm swing, the major stance and swing phases, which are the mid stance and the terminal stance and push off. It is important to note that gait abnormalities could be a result of limitations to develop, rather than a pathology simply specifically wrong, especially when we're evaluating children. So now let's talk about the basis of support. So it is important to understand that in early childhood, the gait is visibly immature and unstable. Their immaturity is demonstrated through the way the child will walk with an extended and a widened base for better balance. Toddlers use this widened base for increased support and to ensure their centerity of gravity is stable. These techniques can improve stability, but unfortunately, this limits their overall mobility. With walking experience, the base begins to narrow. Adults who have matured with their musculoskeletal and nervous systems have full balance and postural control, and they demonstrate a gait that uses a much narrow base of support. Abnormalities such as excessively wide base in early childhood could be just immaturity, but if this behavior continues throughout later childhood, the concern for neurological deficiencies may need to be evaluated. So now, the length of stride. Young children use short, quick steps rather than controlled long strides like an adult. As stated in our textbook, the short, inconsistent stride lengths are seen due to their joints and legs developing rapidly. Once the child matures, the overall leg length and joint mobility reaches its goal. The ability for more efficient strides is seen within the individual's gait. Also, in this comparison, is the better, more effective push-off that the adult will have compared to a young child. It is important to note that while a shortened stride is expected for children, seeing this in an adult should not at all be seen as normal. It in fact could be due to neurological issues, pain, injury, or even weakness. Shuffling gait or uneven step length are cause for concern in adulthood. So now let's go on to the arm swing. Toddlers usually hold their arms in a high position to kind of it's also referred to as the high guard position, which has an additional attempt to ensure balance and overall stability. Their limited balance, keeping their arms up, shows the immaturity of their systems as a whole. And as they develop, the arms begin to slowly drop and become coordinated in what is referred to as a reciprocal swing. This use of a much more rhythmic swing helps the individual maintain their balance and gain momentum throughout their gait. Sorry. If an adult is unable to demonstrate a reciprocal arm string, neurological conditions such as Parkinson's may need to be assessed. So now we're going into the initial contact and loading response. So the use of a controlled heel strike in an adult should be followed by appropriate flexion of the knee joint and the absorption of impact through the plantar flexion of the foot. Young children often hit the ground with a foot that remains flat, joints that are immature and have reduced control, as well as variable knee placement, all of which affects how the initial contact happens in the position in which they are able to push off into their next step. Abnormalities of the initial contact or load response are usually noted as in-towing, and it is a direct result of the femoral anteversion or tibial torsion. There are also specific growth-related changes that can often affect overall coordination of an individual and cause gait inefficiency. We don't want that. So now the mid stance. The major difference between young children and adults is seen in the mid stance portion of their gait. Toddlers or young children struggle to effectively achieve one limb stability, where adults are much more effective in balancing on one limb as they support their body weight. The more unbalanced an individual is through their mid stance, the more energy they will utilize. Abnormalities like excessive sway of the trunk could be evidence of unilateral hip weakness and would need intervention prior to causing significant pain and endurance impact. So slide 9. Terminal stance and push off. When we observe a toddler during the terminal stance and push off phase of their gait, it is easy to see that it is much shorter in duration and is significantly more limited in comparison to an adult due to immature ankle mobility and weakness and underdeveloped nature of the leg muscles. Adults can create forward momentum because their gastrocnemius and soleus muscles are much more developed. So now let's go to our other swing phase differences. So the pre-swing and the initial swing. The exaggeration of a young child as they lift their legs in an attempt to clear their foot from the ground is considerably different than that of an adult who is much more fluid in this movement. The adult's ability to coordinate the movement of the leg is an essential part of the optimum efficiency. If the exaggeration that is seen as common in childhood continues in adulthood, attention may be focused on identifying why. Is the individual compensating for another issue or a motor deficiency? So now, the next part of our swing phase differences. The mid-swing and the terminal swing. So, in the mid-swing and terminal swing, children's hip and knee flexion can be over-exaggerated due to the immaturity of these muscles. Adults well-developed limb advancement and consistent placement of a landing foot. Older adults, overall reduction in controlled dorsiflexion often experience issues with toe dragging, tripping, as well as increase in balance issues, which could lead to falling, which we do not want at all, guys. So now, the lifespan gait pattern summary. More common in an older person's gait is the attempt to maintain overall safety. They often appear more cautious and walk with an overall slower speed, and noticeably shorter stride than previously in adulthood. Like I said earlier, they start to slow down. By making these adjustments, they may reduce their overall fall risk, but they unfortunately experience a decrease in their overall walking efficiency. So it's kind of like a trade-off in a way. As an older adult begins to experience gait changes, it is imperative that we consider the impact of those changes have on their fall risk. We also need to consider that the changes can be indicative of concerning neurological changes and diminishing musculoskeletal abilities. The developmental of abnormalities for an older adult not only can increase their risk for falls and injuries, but it can significantly predict their overall health outcomes and ability to remain independent. So thank you for listening. I really appreciate it. But this as this presentation exemplifies, it is essential that we are able to understand what normal gait patterns across the lifespan should look like. This allows us to be better in our identification of movements that are ineffective, inefficient, or indicative of a pathological abnormality. Then this will help us make informed decisions about how we evaluate our patients and how we can go about creating interventions to help them. Thank you for listening, and here's my references and sources. Thank you for your time, and God bless.